Hi, everyone, and welcome to a live chat with Nurse Linda. Today's topic is skincare. Linda Schultz is a leader and provider of rehabilitation nursing for over 30 years and a friend of the Christopher and Dana Reeve Foundation for close to 2 decades. Now I'm going to turn it over to Linda. Hi, Linda.
Hi, and thank you. Welcome, everyone. It's nice to be with you. This is one of the things about viruses is that people often think that once they have their vaccine, that the virus is gone. Viruses live in our world. We just don't get these different diseases like measles and polio and all these diseases. They're not gone from the world. Those viruses still live out there. We don't get them because we've been vaccinated. So there's quite a difference. So people try to do a lot of health promotion, and they clean up different areas. For instance, polio is very prevalent in stagnant water. Measles, enough people have gotten their vaccines that it doesn't get spread around too much, but it's still out there. And the reason why we know that is because sometimes there are people that get in groups that don't have the vaccine, and all of a sudden they get these diseases. So they're still out there. So it's not like they go away. It's just that we don't get them because you have the vaccine. So anyway, we're going to talk a little bit more about that coming up, because there's some questions in the queue about that. But let's open with talking about skin, because we're having a part two, so to speak, about skincare. Bowel, bladder, skin, those are the big three that we really have to concern ourselves with after spinal cord injury, but it could be after brain injury, it could be after stroke, it could be after any kind of paralysis, diseases that cause paralysis. So we're all in this together, all of us, a whole bunch of people are in the thick of this. So there were a lot of questions last time about aging skin and what you can do to help protect yourself as your skin ages. So as your body ages, there's a substance called cartilage in your body, and it's a lot of it, most of it is in your skin, but it's also in your muscles and in the formation of blood vessels and tendons. And so there's a lot of cartilage in your skin, and it's a protein. Cartilage is a protein. And if you think about a rope, and you have different threads of fiber that are woven together, and those threads alone aren't very strong, but when they're all woven together, the rope becomes really, really strong. And that is exactly what cartilage is. It's protein that makes these threads of proteins that weave together to form like little microscopic ropes in your body. And that's what keeps skin and the underlying structures healthy. So as we age, our cartilage tends to diminish a bit. We never know when this is going to happen. It happens at different points of time to different people. It's not like I could say to you, well, next Thursday, your cartilage is going to be down. For some people, it happens when they're younger. For other people, it happens maybe not until their 90s. It's just, and it doesn't matter if you have neurological injury or not, it's just a little bit different for everybody. So what can you do to help keep your cartilage strong? So cartilage really affects your skin and avoidance of pressure injuries by two different mechanisms. One is you have cartilage in your skin, actually in the different layers of skin, that's cartilage is holding that all together. The other thing is that you've got it in your muscles and your underlying structures. So if you are sitting on, say you're sitting on your rear, or you're pressing on your elbow, or, whatever bony prominence is that you're putting pressure on, you can get skin breakdown because those layers of skin are not strong enough with cartilage, or you can have the underlying structures that are not strong enough to support that upper layers of skin. And so you can have problems there, or you can have both. It can be a combination of things. So how can you help keep your skin healthy? And the unfortunate answer for people like me, and probably for many of the listeners, is that you really need to start protecting your skin in your childhood. Now, for people, I like to say of a certain vintage, like me, I am of a certain age. And when I was growing up, there was a thing called suntan lotion, but we never used it. Our badge of courage was to go out in the summertime and get that sunburn so then our skin would start tanning, especially if you're real fair, like a person like me. So what happened is that those of us now, and those of us who are again of a mature age, we are going to the dermatologist, getting our skin checked for skin cancers because we didn't protect ourselves well enough. So if you're at any age, start protecting now. Start protecting this afternoon. If you go out in the sun, wear a wide brimmed hat so that you have protection on your face, the back of your neck, your ears. If you have a part in your hair, a lot of times people will put on suntan lotion or uh, sun lotion protectorant, and they forget to dab a little in that part in their hair, and they come home with a big old sunburn up there, the tops of the ears, your hands, any exposed area, just slather that on because you really need that protection. Our atmosphere has changed, and the sun rays are a lot stronger, and they're a lot more dangerous than they used to be. So we really need to take that extra protection. Hydrate yourself as best you're able. Some people can't drink a lot of water because of their bladder program. They might have some limitations, or they might have cardiac problems that or edema problems that requires them to monitor their fluid intake. But try to take as much fluid because that helps puff out the skin and those underlying muscles, which makes our bodies a little more cushy. So those are good things to do. If you smoke or inhale anything, it could be cigarettes, e-cigarettes, um, marijuana, whatever you inhale into your lungs, don't do that. The only exception I give is for people who are taking medications like for asthma or COPD that are opening up the lungs and those little tiny sacs in the lungs to get more oxygen into your body. Smoking, anything that you inhale into the lungs, if you live in an area where there's a lot of pollution, you want to have some kind of filters in your home to help reduce breathing in all those fumes or vapors. You might not even be able to see them, but those are getting into those little lung sacs and they're clogging them up so that oxygen and good substances that you're breathing in, that oxygen is not getting into your body. And all the cells in your body need that oxygen to survive. So you want to be able to get that in there. Now, there's a lot of people out there, oh no, e-cigarettes, I see the ads. I've read stuff about them. They're perfectly safe. No, they are not, period. Period. They are not. When you inhale things into your lungs, even if it's flavoring, it's not nicotine, but it's scented, it's flavoring, it's some kind of something. No, there is residual there. So don't do that. Some people will switch from cigarettes to e-cigarettes in their process of trying to get off their cigarette habit, and that's okay. But sometimes I talk to people and they're on their e-cigarettes 4 years later or even 4 months later. That's just changing one habit for another habit. Now, I know this is a very hard process because nicotine is addictive. Your body will crave it. And so it's very difficult. So talk to your healthcare professionals. There are treatments. If you've tried it and you think, oh, it didn't really work, try it again, because not everybody can do that. This is a tough, tough problem. So not everybody can do this on their first try. It may take your fourth, it may take your 10th try, but keep at it. And eventually you will hit with success. So anyway, you want to keep your lungs clear. You want to eat a healthy diet because all these cells are needing nutrients. Every single cell in your body is needing a nutrient. So keep a healthy diet. Monitor your skin. If you have decreased sensation, you're not moving about. People in their younger age think, oh, I look at my skin, it's fine, it's fine, it's fine. And it is fine until one day it's not. And these pressure injuries have a way of creeping up into our bodies without even, before you even notice it. The other thing is you have to do those pressure releases. You have to check if you have any kind of area that has a change in pigment. Sometimes people will call them bruises, but anything that's in a change of pigment for your skin, that's why you have to look and see. So anything that's a change of pigment in your skin, you want to stay off that area until that pigment returns to your normal pigment color. People think, oh no, I can't stay in bed for a day, or I have to sit up, or I need to go brush my teeth. Or no, you have to stay off of it, because if you can catch that early, you're going to save yourself a world of trouble later on. So these are just things that you need to do. You just need to be hyper vigilant about your skin. Check your pressure dispersing equipment. There is no piece of equipment that will protect you from getting a pressure injury. You have to do the pressure releases. You have to rotate yourself when you're in bed. You have to lift yourself, use your tilt. The pressure equipment can disperse pressure. It can reduce your chances of getting a pressure injury, but it cannot eliminate your chances of getting a pressure injury. So check your equipment, because you know what? It's not replaced very often, as you all know. It can be difficult if you have a piece of equipment and is 10 years old. It might not be working up to the abilities that it did when it was new. Your body's constantly changing. Maybe you've put on a pound or two. Fat does not disperse pressure. Fat works is an enemy to pressure, because it condenses like a pillow or like craft foam that provides more pressure to your areas. You really have to have medical grade equipment to reduce those pressures. So look at your equipment, talk to your healthcare professional. If something happens to your equipment, it gets a hole, something's wrong, it's not working as well as it should, talk to your healthcare professional to see about getting a new piece of equipment. They can help justify that to your payer. They also, you can go to, usually in a rehabilitation setting now, or a physical therapy setting. Sometimes in occupational therapy, they'll have pressure mapping devices. And so they can put this, it's just like, well, it really kind of looks almost like an incontinence pad. But it's just a piece of what looks like fabric, but it's got a whole bunch of fibers in it. They put that in between your body and your pressure relieving equipment, and they can map out where the pressure areas are to see if those bony prominences are being protected. To see, it can tell you, if you're sitting more on one side than on the other side. So sometimes your pressure equipment can be made to help balance you out. Sometimes people have equipment, pressure reducing equipment at the back of their wheelchair as well, on your feet, all these things. Now, you've probably seen on TV, there's a commercial for Dr. Schultz where you can go, they advertise, you can go to their store and you can stand on a machine and it shows you where the pressure is in your feet, and then you can tell what product of theirs to buy. This is the same technology that they use for your whole body and pressure, checking your pressure areas for your body. So if you've seen that on TV, you'll know what I'm talking about. The spots that have more pressure are red, and then you'll see when you get the correct pressure dispersing equipment, you'll see that those red spots go away and that pressure is dispersed out. So those are kind of the things that you need to do, is to watch and check and be sure and do your pressure releases. So I'm going to go ahead and answer some of these questions. We're going to also get to more of the questions that we did last week. Now, sometimes I might be answering several questions all together. So if you hear something that sounds kind of familiar, I'm taking a question and kind of rolling it in so that we get more responses out there. The first one is, and this applies to skin, but it applies to lots of things. The first question is about possible funding sources for durable medical equipment. And as I was saying, this can be a challenge to get the equipment that you need. Usually payers pay for the equipment that is, I will say, kind of the minimal that you need. And sometimes people see different equipment and think, well, that would really make my day a lot easier. And it would, but unless there's some medical necessity, it's really hard to get the equipment that you need. Sometimes your wheelchair wears out before you're authorized to get a new one. Durable medical equipment can wear out before you're authorized to get a new one. So getting equipment is quite a challenge. Now, you can go to your healthcare professional, talk about the equipment. Sometimes if you want something in particular, they can send you to therapy. Most policies, if it's a private payer or if it's a public payer, most policies have 2 weeks of mobility training built into your policy. So you usually get 2 weeks of therapy per year. You always want to use that 2 weeks. Most of the times they'll say it's for mobility training. Well, if you need a new wheelchair cushion, you can go and have your 2 weeks. It doesn't have to be Monday through Friday for 2 weeks. It could be like every Monday for 14 weeks, or, there's all different configurations. You can take 2 weeks in the spring and not do the next 2 weeks till the winter, so or 1 week in the spring and you can do it however is best for your situation. But you can go, and getting new equipment can be classified as mobility training because you might be learning to get on and off this new piece of equipment. And if you try it out in that kind of situation and there are benefits, then you can use that with your healthcare provider to write a letter. It's called letter of medical necessity, and they can write to your payer and see if they cannot get that piece of equipment for you. Now, a lot of people will go to these GoFundMe pages. Those are great. Sometimes people will donate a certain amount of money and you can collectively get enough. Be careful with those, especially if you're on Medicaid. That does count as income. Also, when you declare it on your taxes, that does count as income. So it, you need to be careful about if you're able to do that. You don't want to interrupt your Medicaid funding because you've gone over your amount, or if you whatever your payer is, be sure and watch out for that. But a lot of people will do that. There are organizations that will help you fundraise. There's one that works and contributes to the Reeve Foundation called Help Hope Live. It's called Help Hope Live. So if you look up on the internet, you'll find them. They're lovely people there. They will help you create some funding, and then they hold the funds. And now I might be wrong about this. I apologize to my friend that works there, but they will help you organize your funds so it doesn't interrupt your payer. So they will collect the funds, pay for whatever it is you need, and then provide you with that need. So you get the funds, but you don't get the cash in hand, so it doesn't mess up your funding. So and there's probably other organizations. If you belong to a religious organization, a community organization, a lot of these places are willing to help people provide different pieces of equipment that they might need. So say you call up the Kiwanis or the Elks Club, or maybe Knights of Columbus, a religious organization. You call up, I'm in your community, maybe I'm in your organization, maybe I belong to this religious affiliation, and tell them, what you're looking for. Your insurance is not, your payer is not covering it, and you need this for your health. Sometimes they will help you fundraise, and they will do the fundraising and gift you with this piece of equipment. Now, a lot of people will do that, and they will call and talk to somebody, and they're very nice and polite, but you didn't hit quite the right person. Maybe they're not high enough in the organization. They don't know quite how to do that. Don't despair, just wait, ask if you can speak to somebody else. Call back in a few months, try to talk to somebody else, try to talk to the president of the local organization. Just keep Always be very polite, but just keep working the system. Some people go on TV. I see people on my TV all the time talking about, they have a nephew or they're taking care of their son and they need this equipment. And so sometimes people will help. There are different foundations around that keep storage lockers, especially if you have paralysis from a disease process. You can call that organization and see if they have an equipment closet. And so sometimes they will loan you equipment. That's very helpful. I've used that for a family member myself, and we got a tremendous amount of equipment through that organization. So that was very, very helpful, and we were very grateful about that. So anyway, those are just some suggestions. You just have to keep kind of wibbling around, looking. Sometimes friends will hold a fundraiser, a spaghetti dinner, or maybe if you eat at a local restaurant and you talk to the manager of the restaurant, I'm really having trouble getting this piece of equipment. Sometimes they will have a night and they'll say, we're donating our profits of this night to so-and-so to help them gain this. And, they advertise in there and people will come and take advantage of, a good meal and a good cause. So there are all kinds of ways. It is not easy, I guess, is what it all comes down to. So good luck. And I know there are several questions about how can I get these things? And so these are our things. Prices are coming down on different things. You can look, you can buy medical equipment. You can also look on Amazon for different pieces of equipment that you might need, or Walmart or any of the big box stores. You might be able to get the equipment that you need at a much cheaper price. It won't be the deluxe model, but it might be just the thing that you need. So, look around, do your shop comparison and those kinds of things. So we have a question here in the chat box. It's about a 57-year-old individual that's C56 from an auto accident in 1985. So that's quite some time ago. So 36 years ago. And so congratulations, you are a survivor. And, people who have been injured, if it's 36 years, if it's more, if it's one day, you are a survivor. So congratulate yourself, and whatever you're doing the right thing. So good for you. Congratulations. Sometimes people think, oh, 36 years, we have to think about how we think about things. So 36 years is quite an accomplishment. So presently she has, or I'd say she, it doesn't identify if it's male or female, but presently there's some dead skin on both bottom cheeks and ankles that's peeling off, but they're getting treatment. And so keep up with that. So that will help. The treatment that they're doing is really outstanding. And so that will help for this particular situation. Now, stay off of it, stay off the areas. If it's on your bottom, that means sitting. So that means avoiding sitting. The more you can stay off, the better off you're going to be. Every time you sit, you're adding more pressure. So you're kind of undoing what has been done by staying off of it. This person's also a diabetic. So that's going to be an issue, especially for that ankle, because people who have diabetes tend to develop circulatory insufficiencies, especially in outlying parts of their body, like their feet and toes. So you might ask if you need to elevate your foot to help the healing in there. And the other thing is to stick strictly to your diet. Don't deviate. You don't want your blood sugar to go off the charts or down too low, because you're trying to get those wounds healed, and blood sugar does affect that. So stick adherently to your medication and your diet. Now there's a lot in this question, so it's really kind of nice because we're going to cover a lot of information. And I know this is something that several people have written in about. And this person is sweating when they lay on their left side. And so they get very sweaty. Now, there's a lot of questions about sweating. And I did a blog. If you want to look through, search for the blog, I did a whole blog about sweating. Sweating is a problem with the autonomic nervous system. And I know somebody else wrote in and said, why don't I sweat? And somebody else wrote in, why do I sweat too much? It's the autonomic nervous system that controls sweating. So that autonomic nervous system controls everything in our bodies that happens automatically. And so sweating is one of those things. Usually, most typically, people do not sweat below the level of their injury. People who have a stroke or a brain injury might sweat on one side of their body, but not on the other. If you have neurological injury from disease, you might have some issues with sweating. But there are treatments. There are treatments for sweating. So what happens? Well, the autonomic nervous injury says there's something wrong in the body. They can't get the message to the place where it wants to go. So the autonomic nervous system just shoots out everything in its power. So sometimes sweating is the thing that it shoots out. Some people will sweat profusely above the level of their injury. Some people, a few people, not that often, but some people sweat below the level of their injury as well. So there are treatments that you can go to your doctor and get treatments for that. There are some medications that help dry up the sweat that also make your mouth dry. Your eyes will feel, itchy, scratchy because they're dry. But there are other treatments too. There are Botox injections that can help in sweaty areas. For people who have particularly sweaty palms, they will, there's like a tray you put in your hands in this tray, and there's like this little electronic current it's just like a little buzz. It's not like a zapper, but it's like a little buzz, and that helps with sweaty palms. Also sweaty feet, if you happen to have that as an issue. So there are treatments for that, but again, it's that autonomic nervous system that's just going haywire. Somebody else wrote in and said, I don't sweat below the level of my injury, but I find that I always have a rash, particularly in the groin. If I don't sweat, where's this moisture coming from? Well, maybe you don't sweat that you feel, but maybe there's a little bit of sweat that's collecting and you just don't sense it, or your skin still feels dry, if you touch it. So that could be an issue. It could be doing that anyway, but particularly in the groin area, where's that moisture coming from? It's probably coming from the rectum, because there's the children's book, The Gas We Pass. Everybody passes gas. You might not hear yourself passing it. You might, it might just be a slight little bit of fluid that you can't even perceive, or you can't notice. Even when you're cleaning yourself, you might not, but there's a little bit of moisture that comes from the rectal opening. So that can be an issue. Another way that you can get moisture in your groin is after you bathe, you might maybe dried yourself completely, but it's still a little tiny bit damp there. Sometimes it's hard to get really dry. So if you let yourself air for a little bit, dry yourself off and then let yourself air for a little bit. Or, in the groin, there's a lot of nooks and crannies there. Your legs can be pushed together. You might have a little bit of skin that lapses from your abdomen and is pressing on your upper thighs. So, that can retain moisture in there when you catheterize, or if you use even an indwelling catheter. Sometimes moisture escapes around the catheter, but it's imperceivable kind of moisture. So there's moisture, especially in that groin area. So a lot of times people will lay for a little while at night and frog out and kind of dry up that area. There's a lot of people who put different lotions and ointments there. You can get prescription. One of the best lotions that I find right now is for children with diaper issues is called butt paste. It's a real thick zinc type of lotion. It's you put it on and it's kind of almost impenetrable, but it's also so thick it's hard to get off. And sometimes washing your skin enough to get that off is a bit of a challenge. So, try different things. If you have a rash someplace, sometimes what works, you might be using some kind of rash ointment or powder for a while, and then all of a sudden it's not working anymore because rashes change. It's like viruses change, rashes change as well. So you might need to, try different things to see what works best on your rash. Another question this person is asking about is they're having some blood pressure problems, and that's orthostatic hypotension. So there's somebody else who has written in about this, that when they lean over, they're trying to do some exercises with therapy, and when their body leans over, they get this dizziness. So after you have neurological injury, sometimes, again, that autonomic nervous system is not being able to communicate to the lower half of your body. All of us, no matter what, when we change position, we don't notice it because the autonomic nervous system is working automatically. So we don't know that it's happening. We don't have to do anything. It just happens. It's kind of wonderful. But when we are laying down in bed, or if we're in a chair and we sit up, anytime we change positions at all, the autonomic nervous system will say, hey, somebody's changing position. We always want to have enough blood pumped up to our brain. And so when we change position, the body accommodates for that. The heart will pump just a little bit harder, a little bit faster, just for a little while, to pump that blood to get enough up to our brain. Otherwise, you get dizzy. And then also in our legs and in our lower body, even in our arms, the vessels will contract a little bit. We don't feel it, but the blood vessels will contract so that there's more blood pressure to get that blood up to your head, so you don't get that dizziness. After any kind of neurological injury, sometimes that doesn't work so well. So people, probably when you were in the hospital, in the rehabilitation facility, you wore those TED hose. That helps compress the legs, which helps with the blood pressure so that it gets the blood pumped up out of your legs, because those are far from your heart. So that's where your blood pressure is the least, is down in your heart and feet, which is why it's so hard to heal sores on your feet if you're diabetic or if you get a pressure injury. That's where there's the least pressure down there. People will wear abdominal binders. So I know this person is having that problem. Naturally, after spinal cord injury, sometimes after other neurological injuries, over time, your blood pressure tends to lower. It's always wise for everybody to have a blood pressure cuff to know what your normal is. Because when you have problems like this, and you have this high blood pressure and then the drop in blood pressure, that's when you get that dizziness. So that's orthostatic hypotension. It's most often treated by using the abdominal binder, using the TED hose. Maybe if it's possible, if you can drink more fluid, that tends to help. You don't want to mess up that bladder program, but if you can, that tends to help. There's also some medications that can be taken that will help with those blood pressure changes. So, there's a variety of things to do. For the person that's having the problem when they're bending over, their therapist told them that that was probably anxiety, because yes, you feel like you're going to fall over. That's scary. Maybe you have fallen over and you don't want to do that again. That could be exactly what it is. The rehab nurse in me, when I hear about somebody who has a neurological injury and they're having this dizziness with this drop in blood pressure, boom, it's orthostatic hypotension. Now, for the person who's bending over, usually the way it's diagnosed is your blood pressure's taken. When you sit up, your blood pressure's taken again. There's a drop, you notice it. Because it's when you're bending over, it's that trunk part that's really having the problem, although your legs still need to be considered. So wearing the TED hose, wearing an abdominal binder, and seeing if that corrects the problem, my guess is that will correct the problem. And so that will be an opportunity that will take care of that. The last thing for this person is discuss bladder spasms with the neurogenic bladder and suprapubic catheter. So bladder spasms, if you see them on the outside of your body, they're probably on the inside of your body. So if you have leg spasms or arm spasms, maybe you'll notice spasms in your muscles in your trunk. Depending on the level of your injury, you probably have spasms on the inside, which can come from in the bladder or in the bowel as well. Sometimes those spasms can slow down a bowel program. If you have external spasms in your leg, you're probably having some spasms in your bowel as well. And so you want to be as gentle as possible with your bowel program because you don't want to stimulate. A lot of people get in that bowel program and they're going to get that stim done and they're going to do it as quick as they can and get in and out. That's triggering more spasms. So be gentle and slow with that. But these are spasms in the bladder. And so what if it gets to be a huge problem? There is medication that goes through your whole body. A lot of people don't like that sensation. They feel tired. So a lot of people are opting and really the primary treatment now that I am seeing for bladder spasms is Botox injections into the bladder. Now they do it with they put a tube into the bladder and then they inject certain spots. There's not a lot of pain with that. It has to be done periodically because Botox tends to wear off after a while. Your body, where the Botox has been given, your body regenerates. And so the spasms tend to come back. So sometimes if you move your legs more, that can help reduce spasms, but again, gently. Triggering spasms can be done with fast movements. Those are going to stimulate the spasms, but gentle movement. Those certainly help. And then how can I find out about my weight? My primary's office doesn't have a wheelchair scale. If you contact your rehab hospital or if you contact a hospital and ask if they have one, if you call a long-term care facility, they have scales where you can measure yourself, weigh yourself. And oftentimes they will let people come in and use that equipment. You have to call the head of the facility and ask them, tell them what your situation is and ask them. Now, this sounds rather crude, but it's worked for some people. So I'm just going to say, sometimes if you go to like a grocery store where they might be weighing things, they have larger scales there. And so you can maybe try that. I have had people who've actually done that and they go pretty regularly and get themselves weighed. Now, eventually you have to, get out of the wheelchair and have the wheelchair weighed. So you weigh yourself in the wheelchair with all your equipment, but then you have to have a place to sit or to be where. That's why going to a hospital, sometimes that's helpful in just doing stuff like that. So here's another person that's looking for getting equipment with Medi-Cal insurance. Again, use that letter of medical necessity and look at your policy. It will tell you what you are paying for and what you are not paying for. If you have public insurance like Medi-Cal, or if you have Medicaid, find out your policy number because they have many policies within each company. Find out your policy number. You can call the number on the back of your card and ask for a copy of your policy, or you can look it up on the computer, but you have to know the number of your policy to get yours. So I could have Blue Cross Blue Shield, you could have Blue Cross Blue Shield, but we could have completely different policies. So you can't just look up the name of it. You have to have that number. So if you know what's in your policy, you know what you're eligible for, and you might find things you're eligible for that you didn't know, but you're also going to find things that they're not going to pay for. But that's why you have this back door, which is that letter of medical necessity. So that is where you need to go with that. Talk to your healthcare professional. We kind of talked about that earlier as well. So this person's approaching 3 years. Again, congratulations, C56. So she's had some tendon surgeries to give her some better arm-hand functions, and she has a suprapubic catheter. Bowel management is not covered under insurance. Yes, that usually falls, unfortunately, to family, but she has some friends and some nurses who are helping her out with that 3 times a week. So that's a good resource. So she would like a procedure to return her dignity, but they're kind of apprehensive about it. I think maybe they're looking for, maybe thinking about colostomy, maybe. That I'm thinking with the bowel program, they don't say, but they're looking for something. Well, surgery when you have any kind of neurological disease is a bit more risky than with the general population. Doesn't mean you shouldn't have it. You just have to know the risks going in. Now, some people will opt for a colostomy, and there are people that have them and love them. And there are people that find it really didn't really change much. In healthcare, we try to keep, in rehabilitation, we try to keep people using as much of their natural bowel function as possible. And thinking about a colostomy, you need to think about somebody still is going to need to change the bag breaks. It can break. It's not necessarily the panacea that you might think that it is. So, you have to weigh the risk and the benefits of everything. Talk to other people who've had it. Again, look at all those risks and benefits of the colostomy. Go online. There's a lot in the Reeve Foundation about moving to colostomy. Again, it works out great for some people not so much. So it's not like a clear-cut answer. I do not have a clear-cut answer. Another thing with the super pubic catheter, if your sister, now that's probably, it's there, somebody has to change it probably. You might want to think about the mitral fan off, and I know somebody else had asked about that. That is a procedure for individuals where a little entryway in through the belly button is made, and usually they take the appendix and they reroute that as like a tube to the bladder. So you can catheterize yourself by putting a catheter into your belly button, draining the urine out. Children, it was developed for children, but a lot of, in particular, women do this. Males have a different external genitalia. It's easier for them to cath, but a few men have gotten it as well for particular reasons. And so that's something to think about. If you're happy with a suprapubic, just leave it alone. Don't do anything else. But if she wants to catheterize herself, which would involve, catheterizing several times a day in management, and all that sort of thing, that would be controlling your fluids as well. Whereas a suprapubic, it's just there and the urine drains, but it still has to be changed. So again, if you're thinking about dignity, they're just different things to think about there. So I know you're looking for an answer, particularly about that colostomy. And again, I say some people really like it, and some people, it has not been so fortunate for them. So we have a person who has a transected spine. They're from another country, and they're presently in bed at T11, T12. But it triggers me because somebody else wrote in about T11, T12 injury. Now it says spinal cord transection, and this other person said spinal cord transection. And I want to talk about that for a minute, because the way spinal cord injuries are classified is in that Asia category, the American Spinal Injury category. In other countries, it's called the Frankel scale. They're very similar, but they're a little bit different, but it's basically the same thing. So usually an A level is a complete injury. Now, people interpret that, and healthcare people interpret that as a complete transection. Very, 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 very rarely does somebody have a complete transection. Maybe if you had a knife injury, maybe if you had a bullet that passed exactly through the center of your spinal cord, it might completely transect it. But generally speaking, people confuse a complete injury with a complete transection. The terminology when we talk about a complete injury is that nothing is traveling down to the bottom level of the last spinal nerve in the sacral nerves. There's no communication in that sacral nerve. That is a complete injury. But I like to point this out because generally speaking, people's spinal cords are not transected. The spinal cord is in the spinal column, it's under some tension. So if your spinal cord is transected, it will pull up towards the brain because there's some tension that's pulling it down to keep it. That's a natural. So when that gets transected, usually the spinal cord generally retracts up, so the level's much higher than it would be, and it kind of messes the whole spinal cord up, because now it's all out of kilter where the nerves come out of the spinal cord out through the vertebrae. So anyway, generally they're not transected. So if you're in bed, be sure and be turning yourself. See if you can get some pressure reducing equipment. Somebody wrote in about how can I reduce pressure on a motel bed for 3 or 4 months. So they're going on a trip or something. You can't, regular mattress will not cut it. You have to have some kind of pressure reducing equipment for that person who's traveling, you'll need to take your pressure reducing mattress for your bed with you. Sometimes I see people traveling and they have all kinds, their shower bench and all these different things. Lots of places now have that equipment available when you go to different hotels, but they don't have pressure reducing equipment. If you're going to be in one place for a certain amount of time, you can rent in that particular city, or you need to bring it with you because a regular mattress will not cut it. So you'll need to unfortunately take that with you. But for our friend here outside of our country, keep turning, try to get pressure reducing equipment. If you can get a wheelchair, be sure you have pressure reducing equipment in your wheelchair so that you can reduce your pressure. Now there's all kinds of information at the Reeve website, and they're listed here in the chat box for you. Somebody wrote in earlier that they're looking at skin integrity versus MediHoney for a small open wound bed sore, and either one of those are perfectly good. It depends on your pressure injury and what is being prescribed for you. But I do want to bring up the honey. There is some honey treatments, and it goes in and out of vogue. It's, it becomes the thing, and everybody's using the honey, and then then they, oh no, it's, it's kind of messy and sticky, and so anyway, it goes in and out. The idea of using honey is it's a natural sugar, and that will feed those cells. Yes, it does, but it can't get to the cells further in. Yes, it works for many people, the honey. The problem with the honey is you have to get the medical grade honey, and they're talking about the MediHoney, which is really important to notice that there's a difference, because I was just talking to somebody, well, it's been a couple of months ago now, but I was just talking to somebody a little bit ago, and they were talking about that they got some honey. They had some areas on their feet, and their neighbor gave them some honey from their beehive. Now, honey is naturally sterile, and so that's why people use it. But there's a lot of vermin that roam around those hives. If you've ever been to a beehive, there's a lot of rats that enjoy, mice and rats and creatures that enjoy that honey. So if somebody is taking it out of their hive, they could have some particles or something. So, you might not want to be putting that directly on a open pressure injury. But the medical grade, they've taken care of all of that. They made sure that it's safe to use. But what this person told me was, oh, I haven't put it on my toast yet. I'm going to start eating that. No, you've got to put the medical grade honey on the wound. Eating it through your body, no, that's not going to get where it needs to go in enough quantity to do anything. So you know, just don't get some honey and, you know, go to the store and think, oh, I'm going to have some honey and my wound's going to heal up. No, don't go to the store and get some honey and think I'll slather this all over my, no, get, you know, use the medical treatment that's been prescribed to you. That's going to be your best bet. There's a comment here in the chat, and I really want to talk about this. 43 years and I'm still here. So, all right, congratulations. This person had some stage 4 pressure injuries, and now this is not an exaggeration, but he says when he was in the hospital, I had to be tied down so I could not move due to a heart pump. We finally got it healed up after I got home. It is not unusual if you have to have surgery or if you have these stage 4 to be hospitalized or to have to lay in bed. You can put no pressure on these wounds. You shouldn't put pressure on any, even a change in pigmentation. But a lot of times people's wounds get so bad like this, you know, it was because they could not move due to this heart pump. And, you know, sometimes it's more dangerous to turn somebody with a heart condition in the ICU than turn them. So then we end up with these pressure injuries. And so, but this is not your case at home. You can still move and you have to turn when you're at home. But when you have surgery on these wounds, people think, oh, I'll have surgery, they'll sew them up. Well, let me tell you, the skin is very fragile after surgery. They move the muscle underneath to give you that supporting structure for the skin. It's a big involved surgery. It's not anything to be taken lightly. And then that skin is always, once you've had a pressure injury, it's always susceptible. It's not as elastic as your original skin. So a lot of times people will go to the hospital. They might be on bed rest for 6 months or longer. They cannot put any pressure on that surgical site. You don't want to get to that spot. So this is the cautionary tale. Stay safe and try, you know, keep off of those. Don't let them go, you know, and above all, you get a pressure injury, you do your best. They happen for whatever reason. If we knew, you know, that would be great. But sometimes people do everything and they happen. So don't sit around and think, oh, I didn't do this. Oh, I'm a bad person. No, it's not your fault. Pressure injuries happen. And so, you know, resolve yourself of that now. You have my permission. It happened, and now we move forward, and we move forward with that. Okay, here's a very important question about the COVID. Well, first of all, they want to know about getting equipment repaired, and there's people who write, I can't get a doctor's appointment because of COVID. Somebody wrote in about their child had Hincock-Schonert-Line purpura disease, and they couldn't get an appointment. No, I think that was the one who couldn't get the appointment. They wanted to know if this would be appropriate. That's a vascular system disease. And yes, skincare is appropriate to that. And please get the skincare from the sites and the Reeve Foundation. Because it's a vascular disease, you can have breakdowns and not overbloating prominences, but you need to know how to heal those up. And so, yes, you'll need to follow that. But there was somebody else who wrote in, well, their child had Stevens-Johnson syndrome, and they were trying to get an appointment, but they couldn't because of the COVID. Now things are loosening up, so you can get appointments. But if you, during the COVID, people were trying to do things like they would in their normal life, and they would call up, I think my child has this problem, they need to see this doctor. No, you had to get a doctor's referral. So for that one with the Stevens-Johnson syndrome, if you got a referral from your doctor, you can usually see a doctor if that's the problem. But repairs to equipment is difficult. And this person, they had a video conference, you know, video chatting like we're doing is wonderful. It really has saved a lot of people that they could still see their doctor, but sometimes people need to lay eyes on exactly what's going on. So if it's really difficult to get to the doctor, you feel unsafe going outside because of all the COVID issues, the videos are a great opportunity. But sometimes, you know, you really need to have some hands-on. So, you know, when you feel safe, try to go to your appointments if that's at all possible. Video doctor's appointments are apparently going to be here now for, to stay. So that's going to help a lot of people who have to make frequent appointments. So that's a good thing. But every once in a while, you want to be sure and see your healthcare professional so that they can go ahead and have that hands-on feel what's going on. But unfortunately for this person, they tried to get their wheelchair repaired. They did a video conference. The parts came. They were the wrong parts because they couldn't see everything because of the video. And that is so unfortunate. So that's, yet another fallout. There's so many things that COVID upset. I'm sorry that happened to you, but hopefully now that the guy is able to come, maybe, they'll be able to fix that. So now here they're talking about, this person was talking about that they were told to get the first vaccine available, which yes, any vaccine is better than no vaccine. So yes, absolutely. And so they got the Johnson & Johnson. Now they say it's pulled off the market. It is not pulled off the market. It's still available to people. It's a one shot. It's made with the traditional vaccine way where they take some dead virus and they put that into your body and your body builds up immunity. And so that's the way all our vaccines are made. That's the way it's done. Maybe they didn't take a dead virus of the COVID. Maybe they used one of the other SARS vaccines. The new mRNA, the Moderna and Pfizer vaccines, are made with this new mRNA technology. Now, the technology is not new. It's been out there for 40 years. They just had to point it towards the COVID, which they did because we know how to do the human genome. We know how to do genome sequencing now. So once they got a COVID virus and they sequenced the genome, they only had to change the mRNA to affect the COVID genome. So people say, oh, I'm not taking this, the mRNA, I'm not taking this, it hasn't been out long enough. Yes, it has. It's been out for 40 years. It's well tested. Millions of people have had this. Are there some side effects with some people? Yes. Are there some side effects for some people if you take a Tylenol? Yes. So it's again that risk versus benefit. And you have to think about what your risk. You have neurological injury, you're immunocompromised. If you're also diabetic, if you also maybe have arthritis, you have the more and more comorbidities, you're not moving, immobility. If you have put on a little weight because of your injury, all these things are adding up. So think about that. So the Johnson & Johnson vaccine now has a black box warning. Those are put on certain drugs where they say, we're just letting everybody be aware that there is this issue. It's something we're really going to draw your attention to it. It's not just going to be like in the cautions. This is like a special little black box warning. Well, how come they got that? Well, because some people who got the Johnson & Johnson vaccine developed Guillain-Barré syndrome, which is a neurological disease, which usually starts at the feet and paralysis slowly creeps up the body. It can stop anywhere where it's going up. It can go all the way up to the head. You do not lose your cognitive function. It goes up high enough, you lose your ability to breathe and move your eyes, but you're still cognitively aware. However, after some undetermined amount of time, it tends to go back down the body the same way it crept up. It goes back down. Sometimes it goes all the way down and people are resolved of it. Sometimes there's some paralysis, maybe a foot drop. Sometimes there's different, some people have a lot of residual from it and some people don't. In the United States, between 3,000 to 6,000 people every year get this. 2/3 of those people, and it attacks, I want to say, I wrote it down here. 2/3 of these people get it after they have a certain kind of virus that gives you the flu or gives you diarrhea. and a little bit after they have this virus, they get the Guillain-Barré, but not the majority of the people who get the flu and diarrhea don't get this. It's just a small number of people. So it's not like, you have to be like really leery of this, but this is what this is. Um, so, um, um, 12.8, this is from the CDC, 12.8 million people got the Johnson & Johnson vaccine. Of those people, about 100 developed Guillain-Barré. Now that is less than what would be in the normal population. So, the first thought is, well, would they have gotten Guillain-Barré anyway? I mean, who knows? We'll never know the answer to that. But what is curious about this is they all tended to get it 42 days after they got the shot. Red alert, there's an issue. So it's a very small number of people who got it, the Guillain-Barré from the Johnson & Johnson. This is only in adults. Now, this isn't that teenage, this isn't in the teenage group. This is only in adults. So it's a very small number of people, but it's the timing of it, that it was all about 42 days after the shot. This is what's got everybody all rankled about this. So there is some thought, and there was a study that came out yesterday, because you see, I do try to prepare for these in some way, shape, or form. But a study came out yesterday, and I'm reading it, and I'm thinking about this question, and I'm thinking, aha. A study came out yesterday in New York where they were looking at the Johnson & Johnson and the development of Guillain-Barré. The issue with this study is it just came out. It has not been peer reviewed. So in medical research, there are people, somebody who does research, they develop their report, they give it to a publisher. Usually the publisher then sends it without their name on it, so nobody knows who it is. And then people with experience in research and in that particular department review those studies. Now, I did not review this study. I do review a lot of healthcare studies for different organizations. I've not seen this study, but they are looking at this. So we're going to hear more about this as soon as it gets peer reviewed, and as soon as we find out, when we review these studies, we look at how the research was conducted. We look at things like what references did they use? Did they look at all the references, or did they just look at some? Was there any bias in there? How the study was conducted? If was there a control group? Was a control group even necessary? So, was this a look at data, or did they look at human beings that developed the Guillain-Barré? So all those things are taken into consideration. So, so is the Johnson & Johnson, is this an issue with Johnson & Johnson, or is this some oddity that came up? Well, we don't know. It's that timing of it that has piqued everybody's curiosity. So the question is, there's some talk out there in the world, and it's just talk. Will people who had the Johnson & Johnson be required to get another vaccination? So that it's just talk, but there's some thought that maybe people who got the Johnson & Johnson might have to get one dose of the Moderna or one dose of the Pfizer, not each, just one more shot. Will that happen or will that not happen? We don't know. Because of the Delta variant, right now the shots are effective against the Delta variant. But as long as the Delta variant is out there and is out there as much as it is out there, as I've been saying since the get-go, viruses mutate. That is what they do. The Delta variant will mutate into something else, and that will mutate into something else. And, this is just the way that this is just the way they operate. So what will happen? Will all of us eventually need, as this virus keeps mutating, will we all eventually have to get another vaccination? Well, quite possibly, but it could be resolved if people would, get the vaccinations, and then, we would have a lower load in the community, which would mean less people would be getting it. So it would have less opportunity to mutate. Like I said at the beginning, with the polio and with measles, with all smallpox, all these things that we get vaccinated against, we don't see them because we're vaccinated. They're still out there. And every once in a while, you'll hear about a little outbreak of polio in other countries, but even sometimes in a small area of the United States, you hear a lot about the measles, having outbreaks of the measles. That is in much larger proportion because of people who are not vaccinated. So, obviously, my personal opinion now about that. There's some people who can't get the vaccine. And for those people who have a legitimate reason, healthcare wise, not to get it, if everybody else gets it, you'll be protected by the immunity that everybody else has. It won't be out as much in the community. So we really have to get this down, folks. We've got to wear the mask. You have to wash your hands. You have to stay social distance. Now, I know that in some places they're bringing the mask back. They said for a while, if you were vaccinated, you didn't need it. For people like me who are immunocompromised due to, I no longer have a spleen. That's the captain of the immune system. So that was through a series of unfortunate events. But I always wore my mask no matter what, because I'm trying to protect myself. I'm trying to protect those people that are around me. So please wear your mask, because it's important. If you have a neurologic injury, or if you're a family or friend or a caregiver or a healthcare professional who's taking care of somebody who is immunocompromised, please be sure and take all the precautions, because we need to keep everybody safe. And I hate to hear about anybody in our community who has suffered with this, because people who have it are report that they are forever changed. So let's keep it out of our community. Let's keep it out of it everywhere. So with that, I'll sign off. I'm sorry, but I really feel strongly about this, obviously. And so we need to get this under control. So I'll see you next month. Remember that I am also on the Reeve Foundation community. If you want to go on there, if you want to email me privately, or if you want to post something, please feel free to do that. I'm on the community every Wednesday from 7 to 8 Central Time. But if you write in any time, I like to try to get on top of those and answer them right away. So thank you for coming today. It's been a great day, and I hope we've resolved some issues.